Good afternoon, everyone, and thank you for joining me today. Here's today's update on the vaccination effort in Pennsylvania. Vaccine providers are reporting they have administered 1,352,248 doses of vaccine as of this morning to 1,049,609 individuals. There are 1,049,609 people who have received their first dose of vaccine. This is 74% of the vaccine allocated received for people's first doses. In addition, 302,639 people have received both doses and are fully vaccinated. This is 30% of the vaccine allocation we have received for people's second doses. We know that the actual number is higher, but there's a natural lag in reporting because vaccine providers have 24 hours to report, and the federal retail and pharmacy partnerships have 72 hours to report. Pennsylvania has been allocated 175,175 doses of vaccine this week to give people their first dose of vaccine. Pennsylvania also has been allocated 143,275 doses of vaccine this week to give people their second dose of vaccine so they can be fully vaccinated. Keep in mind that our weekly allocation is only for 66 counties. Federal installations like military bases and veterans hospitals are receiving and administering their own doses. Philadelphia County is receiving its own allocation and administering its own doses. We have heard a lot of concern from vaccine providers and Pennsylvanians about being able to get the second dose of vaccine. I would like to stress to all providers that the second dose of vaccine for your patients is secure. The second dose of vaccine is essential, and we are ensuring that for anyone who gets a first dose today, there will be a second dose delivered to that provider in time for your second appointment. Providers do not have to set aside the vaccine they receive for first doses to ensure there is a second dose. We have purposefully included your second dose into our allocation strategy because it is essential that Pennsylvanians are fully vaccinated. Getting vaccinated is such an important step in our efforts to stop COVID-19. That's why today we're excited to announce that we're launching a new tool called Your Turn to help everyone understand where they fall in the vaccination prioritization effort and to serve as a way they can be alerted when it is their turn to schedule an appointment. Pennsylvanians younger than 65 can use this tool to determine if it is their turn to receive the COVID-19 vaccine in Pennsylvania. If it is your turn, we will direct you on how to find a vaccine provider. If it is not your turn yet, you will be able to enter your contact information to receive updates about vaccine distribution in Pennsylvania. We will let you know when it is your turn to get vaccinated. Remember, your turn will solely be used for the purpose of determining if you are eligible to receive the vaccine. It does not register you to receive a vaccine and does not guarantee a vaccination appointment. If someone does not have internet access to use the Your Turn tool, they can call 877-PA-HEALTH to speak with a representative to determine eligibility. If eligible, that representative will help the individual find a vaccine provider near them and provide contact information to make an appointment. We are working to vaccinate everyone in Pennsylvania who wishes to receive a vaccination. While you are waiting for your turn to receive a vaccine, you can visit the provider map to view vaccine providers around you. But remember, please do not register with a vaccine provider until it is your turn. As we continue to stress, we must have patience as the amount of vaccine available in Pennsylvania and across the nation is extremely limited. Vaccine is being provided to Pennsylvanians in a way that is ethical, equitable, and efficient. We are asking all Pennsylvanians to know when it is your turn. This way, we can make sure our most vulnerable residents can get vaccinated now. These are the people who are more likely to get very sick from COVID and are more likely to die from it. If we can get them vaccinated quickly, we can save lives. While we continue to vaccinate people in Phase 1A, and as others are waiting, we must keep up our efforts to stop the spread of COVID-19 by masking up, washing up, and maintaining social distancing. Thank you. We'll now take questions.
Thank you. Our first question today is from Sam Zern with PLS Reporter. Sam, go ahead and unmute.
I'm curious about how that's going to work just with your operations. Is that purpose of that task force more to inform the legislature about anything they need to take up, or are you going to be working with them to actually implement any strategies that you come up with in the task force?
Sam, we missed the first part of your question. Could you please repeat? Sam, you are unmuted. Can you go ahead and repeat your question?
Yes, thank you. Can you hear me now?
We can, thank you.
So my question is about the governor's task force and how that's going to work with your vaccine strategy. Are you going to be taking recommendations from that task force, or is the task force purpose more to inform the legislature about what's happening?
I think both. I think that it's very important for us to be collaborative with our legislative partners, but then also to be working internally to figure out the best path forward in our vaccine distribution.
Next up, Tyler Pratt. Tyler, go ahead and unmute.
Hi, Lindsay. Tyler Pratt here, WLBR, NPR for Lehigh Valley. Nice to meet you. My question today is about correctional facilities. Lehigh Valley officials wrote to your office Friday asking for help, expedited testing, expedited vaccines. We know that COVID is a problem in prisons and jails across the Commonwealth. Does your office have a plan to vaccinate inmates quickly?
Yes, we are working with our partners both at the Department of Corrections and at all of the other agencies that we work with across the Commonwealth. Pennsylvania's dedicated local vaccine providers have administered 74% of the first dose allocations they've received from the federal government. And so at the same time, our vaccine providers are focusing on people living in long-term care settings. So we know that CVS has administered 100% of first doses and 94% of second doses in skilled nursing facilities. And we'll continue to work through some of those other long-term care settings, as well as our correctional facilities to ascertain how we can make that more efficient.
Just to follow up, though, do you have a timeline here? We've got people in cells 23 hours a day, stressed staff. I think they're very anxious to have more of a definitive answer. These are vulnerable populations.
Absolutely, yeah. I think that that's something we can definitely work with the county on moving forward to try to ascertain how we might remedy that problem, and happy to do that. And I think any other specifics we can work through with our press office as well.
Next up, Harry Lee from Fox 43. Harry, go ahead and unmute.
Thank you. I know that we have gotten out about half of the doses of the number of people eligible under group phase 1A. If we keep going at the current rate, do you have any timeline on when you could open it up to the next group?
That's a really great question, and something that, again, I think we're all thinking about. But our goal at this point is to vaccinate all folks within the 1A eligibility category, and so that is our focus at this time.
Harry, any follow? Okay. Next up, David Wenner from Penn Live. David, go ahead and unmute.
Thank you. What are you hearing from the federal government regarding the doses that will be coming from Pennsylvania? I mean, for example, maybe say 2 weeks ago, we knew we were getting 143,000 doses. And then I think this week was about 175,000 doses. So I'm wondering what your expectations are as, like, is it going to continue to go up, say, 10,000 doses a week? And one more thing I'd like you to address is, like, for example, if we get 175,000 this week, we'll get 175,000 in 3 weeks as second doses. It's kind of an exponential increase. How much confidence do you have that that growing number of doses will be there?
We
Thank
have, yeah, absolutely. So I think I'll take your second question first. Again, we have all of the confidence to ensure that we have those second doses for providers. Again, those numbers have been included in our counts moving forward. And again, we continue to work with the federal government to determine what the allocations look like moving forward. And just like all of you, hope that they continue to increase over the coming weeks so that we can continue to vaccinate more folks.
Next up, Jim Mandolinsky from WTAE. Go ahead, Jim.
Thank you. Fayette County launched a centralized registration program yesterday for residents to allow providers to connect directly with that list in the county to try and make that process much simpler for people. Where does that process stand on the state level? Is it something that is being considered? And if so, how would that connection be made, and when can people in the state expect to have access to something like that?
At this time, we are not looking at centralized registration systems like those, but again, are working through enhancements to the systems that we do have, like Your Turn, to continue to be able to communicate to folks effectively, ensure that they are aware of where vaccination providers exist near them. And so I think that's currently what our focus is at this time.
Okay, next up, Jim Melwert from KYW. Jim, go ahead and unmute.
With the Your Turn thing, is that, it seems to me the issue has been with people being able to sign up for a vaccination. Is it really an issue for people figuring out where they're in line? It seems kind of like a solution looking for a problem.
We do have a number of folks in Pennsylvania that are not aware of where they fall in that prioritization. So as an education tool, absolutely, it is necessary for folks. We also want to provide it for those services to folks who don't have access to the internet, again, through our 877-PA helpline. And again, we'll continue to work through enhancements of the system to make sure that it's working properly for folks who are utilizing it.
And just really quick with the second dose, we're hearing that there are still some places that are sitting on half of their first dose, concerned about the second dose, and kind of hand in hand with that, is Pennsylvania? You're not actually sitting on doses. You're not holding doses back. This is part of what, when you order doses, part of that allocation will ensure that second dose will go in, will be available. Correct?
That is accurate. Yes, and we'll continue to work with providers on timing as well.
Next up, Samantha Rulin from the York Daily Record. Sam, go ahead and unmute.
Hi, thank you for taking my question. One of the things that I wanted to ask about was, and you said that there wasn't a need to provide kind of a centralized system right now. Is there then any problems that you guys are kind of running into where people are signing up at multiple providers for a vaccine, since there are other vaccination sites, and then, are appointments getting filled that maybe aren't, being tended to or whatnot? Is that causing any confusion from the provider side of things?
I think that definitely there are multiple links out there and multiple ways for folks to sign up. For us, having this Your Turn tool on our website, again, helps folks to find out where they are prioritized in that setup and our vaccine distribution. And again, will help them to figure out in the future where they might receive additional information.
And then just following up something on that in regards to doses is, I've spoken to some hospitals who they talk about how they sometimes do have extra doses, and thankfully they're saying that they don't feel like they're wasting many, at least by the end of the week or whatnot. But they kind of have to operate on this sort of standby system where they could maybe let employees know, in 15 minutes, if you get here, we can give you a vaccine. I wonder if the state knows how many kind of doses are wasted, in the sense of the vaccine's only viable for 6 hours after it's open, I was told.
That's a really great question, and I do know that our press team has that number, so I will refer you to that for that specific number.
Great, thank you.
Next up, Mike from CBS 21. Give me 1 second, and go ahead and unmute.
Thanks for taking my question. Question for this is about the AMI testing sites. There's one in York County that's ending today, began on Friday. We've been out there twice, and to say that it's been sparsely used is probably an understatement. Wanted to see if there's been any talks about shifting those resources away from testing and more towards a mass vaccination type of clinic? A, if that's possible, and do you feel like this at this point may be a waste of resources?
Not at all. Testing is an important part of our COVID response, and so we will continue to work with our providers to stand those sites up. I think, again, though, as we move into this next phase of our COVID response, we are absolutely looking at resources and what makes sense moving forward into our vaccine distribution strategy.
Is there anything that you guys are considering to try and bump up the amount of people that are going to use these testing sites?
I think, again, education and awareness is something that we're always striving to enhance, and so I think that's something that we'll be working with on our comms team and also with our public affairs team.
Next up, Taylor Tasha from ABC 27. Taylor, go ahead and unmute.
Hi, thanks for holding this today. So just going back to the centralized system, what's the main reason for not having one already in place? Yesterday, Representative Davis called on DOH to set it up, saying it's not going to work any other way. We're hearing from, people saying they have they're monitoring multiple different sites to try and find an appointment and register. So what's the main reason for not having this main system up and running?
I think limited supply. We're dealing with a limited supply of vaccine coming into Pennsylvania. This is a problem that's happening all over the country. And so a centralized registration wouldn't help with that issue. And so we are working on, again, just providing awareness and communication to our community members so that they're aware of where vaccination providers exist and where they might fall on that prioritization.
Next up, Flora Pastorero from Penn Watch. Flora, go ahead and unmute.
Hi, Lindsay. Lindsay, before you said that you guys were focused at this time on just phase 1A, and I know you said you're focused on getting everyone through phase 1A, but we're 8 weeks into this vaccination process now that started back on December 14th. You have to have some sort of a timeline. There has to be some sort of a goal to say, we got to be finished with phase 1A by this date and start phase 1B by this date. There has to be some sort of a timeline. Do you have that?
Fortunately, we don't have a timeline for 1B at this time, but just to put it into perspective, it's going to take approximately 8 million doses for the more than 4 million Pennsylvanians currently eligible to receive the vaccine in phase 1A. And so far, Pennsylvania has only received about 2.4 million from the federal government. So again, we're still continuing to collaborate with the federal government to understand how our allocations might grow. But at this point, our focus is on 1A, and that's where it will stay for the time being.
So when this whole thing started, the governor had indicated that he felt the general public could possibly receive the vaccine by spring or summer. Based on the way things are going, that doesn't seem realistic at this point, is it?
We still think that's a realistic goal. Again, we're going to have to work very closely with our federal partners and with our local partners as well, because we know that folks rely heavily on their local providers and on their local communities. So we'll continue to do that so that we can reach those goals.
Next up, Davine Quartz from the Beaver County Time. Go ahead, Davine.
Thanks so much for the time today, Lindsay. I have two questions on two sort of different roads here. My first one is actually a data clarification question. You said earlier that there's 175,000 first doses, 143,000 second doses coming this week to Pennsylvania. But when you look at the vaccine provider location data that's up on the site, we're only seeing 75,000 going to regular providers and 19,000 and 12,000 going to the retail pharmacy partnership. Where are the rest of those doses going, or is this spreadsheet not up to date?
I think that the press office will probably have to get back to you on the details. I do think that there is a lag in that data reporting. And so again, I think I will refer you to our wonderful press team that can help with the specifics of that question.
Thank you. My other question is actually looking a little bit more at allocations. So here in Beaver County, our commissioners today were pretty blunt about the fact that they have requested multiple times to get an increase in doses sent to the county and sent to Heritage Valley Health System so that they could do, they have the capability to do a more widespread, a plan to do a more widespread vaccination clinic. Right now they're doing about 500 a day, and they've said that they could do well over 1,000 with the space that they have. But they feel that because they don't have a health department, they're not getting the share that Erie and Allegheny and other counties with municipal and county health departments are. I know that there's a formula, and we've talked about that, but how much of a role does having a plan that could be easily rolled out come into play whenever you're looking at getting vaccine to people?
I think, again, it's important to remember that the Pennsylvania Department of Health is responsible for 66 counties, and so we have to maintain equity across those counties. And so, again, as we continue to build out this plan, we'll be looking at how local providers are working together. We'll continue to work in lockstep with them to make sure that we can allocate all of these vaccines.
Next up, Ford Turner with the morning call. Go ahead, Ford.
Yeah, I have two questions, and the first would be sort of a reference to Daveen's question and then my own question. With reference to the dose numbers, we have a person on our staff who specializes in data and statistics, and he looked at the spreadsheet that was linked off of the health department press release last week. And it did say that the state's allotment for last week was 75,000, something like that, doses. So my question about the data would be, you've given numbers for the first dose and second dose this week, 175,000 odd and 143,000 odd. Are those numbers determined by the state, or does the federal government determine how many are first and second doses?
So we, again, have accounted for both first and second doses in our allocation to providers and are continuing to work on that allocation. When it comes to those allocations from the federal government, again, we are limited by what we receive from them on a weekly basis, and again, are hopeful that those numbers will continue to go up.
So the state is taking the lump number of doses and determining how many are first and how many are second?
No, we are working with providers to allocate the number of doses and to determine how that's distributed. And in that allocation, we are accounting for both first and second dose.
Okay. The other question would be, is the health secretary going to be available to the press for questions this week?
I am not. I think we'll have to refer you to the press office on that. I am not sure at this time.
Okay.
Next up, Paul Go from the Pittsburgh Business Times. Paul, go ahead and unmute.
Thanks, April, and thanks, Lindsay, for taking the questions. I have two. One is the federal government is going to start, I think, or has started providing vaccine directly to retail pharmacies. Their allotment is going to there. And I believe what they said earlier today, I was on a different conference call, but I believe what they said earlier today is the community health centers as well will be getting this. Is that in addition to what the state's getting, or is that just a different way to distribute it? Does that get counted in your numbers? And then I have a follow-up too.
Sure,
please.
Yeah. Our understanding is that is in addition to what we're already receiving, and we're excited to be able to distribute what's left from those to other community members or to other communities across the state.
So you would get the 175,000 or whatever it would be. That would be 175,000 plus whatever the retail pharmacies are getting and whatever the community health centers going forward will get.
That is accurate. Yes.
And then the other question is, I've seen the numbers of B117 go up, the UK variant. Have you guys got a handle on what's happening there? Is that one outbreak, two outbreaks? Where is that located in terms of the state?
Yeah, so we continue to work with the CDC to determine the variant and how it will affect our response here in Pennsylvania. And so again, we'll continue to work through that and continue to look at that with our CDC partners as well as with our epidemiology team to determine what that looks like in Pennsylvania.
Next up, Erin McCarthy from the Philadelphia Inquirer. Erin, give me just one moment. And go ahead and unmute.
Thank you. Hi, Lindsay. You mentioned equity across the state. The three most populated counties that you serve only got 1,000 doses last week. I'm getting emails from older folks in some of those counties who have had their appointments canceled, one even twice now, and they say they're scared that they're not going to be able to get this vaccination. Since it's Tuesday, I imagine you know the allocation of doses for the week. Will these counties, including the 3 most populated that you serve, be getting more doses than they did last week?
We know that again, as the allocations go up from the federal government, our allocations to our partners will continue to go up. At this time, I can't speak exactly to those allocations in those counties, but can tell you that we are working to ensure that it's equitable across all 66 counties that we're working with.
And I understand that you have limited supply from the federal government, but the Pennsylvania Department of Health is responsible for how that limited supply of vaccine gets distributed across the Commonwealth, obviously. What areas of the rollout are you working to improve right now, and how are you doing that?
Absolutely. So we're working to enhance all of our systems. Again, I think the Your Turn tool is a great example of that, providing education and awareness to folks about where they fall on the prioritization strategy. And then again, working with providers on that education as well is very important. Like I said before, it's important for us to be in lockstep with our providers and with our local partners as we all work through this. And I think, again, patience is something that we'll all have to rely on as we move forward in this process. I know it's frustrating and we're all working through it, but I can assure you that we are hopeful and continue to strive to ensure that folks who want vaccination can get it.
Next up, Deanna Durante, NBC News. Deanna, go ahead and unmute.
Thanks. And also to the moderator, thanks for helping clear up some of the questions we have in the chat. I think it's helpful to all of us to understand. I just wanted to ask, when you say you order the doses that you're allocated or what you're allowed to order, 1, do you always get the number that you're asking for? And 2, is it a set number every week? How much can you ask for from the federal government?
That is a set number every week, and we are allocated what we ask for.
And so far you have had every dose come to you. So when you say that second dose is on order, you're getting them and then you stick them in a freezer and hold them?
We get them and we allocate them and distribute them to providers.
Thank you.
Our last question today is Barbara Barr from WGAL. Barbara, go ahead and unmute.
Thank you. Just to follow up again on the centralized system, I know it's come up quite a bit, and you say supply is an issue, but supply is an issue on the local, on the system that we're enhancing now. And I think some people think it just would be easier if people could go to one place, sign up, put themselves on a list, as opposed to now there are some people who are maybe getting up at 5 in the morning, 6 in the morning, and trying to get into various pharmacy websites over and over, and they get frustrated.
I definitely understand how that could be frustrating. I think, again, the centralized system would not help with the limited supply that we're working with. I will note, however, that the Your Turn tool can help folks, again, with that future communication and to help them determine where they fall in the prioritization strategy. And then again, they're able to enter their information and receive information about future distributions in their local community.
And that would be on the Pennsylvania Health website, the Your Turn tool?
It is live today.
Okay. Thank you.
Thank you. That concludes today's press conference. Any follow-up can happen with the Department of Health press office. Thank you. A recording of this will be on pacast.com.